Mr. Lloyd, hi, how are you?
Hi, good, thanks. How are you?
Good. I'm Jordan. I'm your vet nurse today. I'll just be filling you in on Sophie's surgery and treatment. I'll just go over some details here. You still live at 15 Albert Street, Pukekohe.
Yeah, that's correct.
Great. And your phone number is still 078647558?
Yep, but it's probably easier to reach me on my cell phone, which is 027 350 4351.
Great, that's awesome, thank you. And should we contact you on that number after Sophie's surgery?
Yes, please.
Right, now Sophie is 18 months old.
Yep, she's 18 months. She's a Labrador Retriever cross.
Yep, and she's up to date with vaccinations and been flea and worm treated.
Yep, her last vaccination was about 17 months ago, I think, and she has been flea and worm treated recently.
Great, and I see she hasn't been with us recently, apart from her vaccinations. But has she been seen by any other vets or had any other medication required previously?
No, she hasn't. She hasn't been seen since last year by anyone.
Okay, so she'll require a quick check over, but we can do that after the consultation. She's on no medication at the moment.
No.
And no coughing, vomiting, diarrhea.
No.
Cool. And anything unusual about her normal self that you can think of?
No, she is quite boisterous, but she's very friendly. She might get a bit stressed out in the situation.
Okay, that's good to know, Mr. Lloyd, but please don't be concerned as she's in the best hands possible. We'll take great care of her.
Okay, thanks. That means a lot.
Cool. And do you know if Sophie is in heat or what stage of ostrus she is in?
She's just been in heat maybe a couple of weeks ago, but you may need to double check.
Yeah, okay, we'll check that over in the consultation just to be sure. Is there any chance she could be pregnant or has she been mated?
No, she hasn't been in contact with any other dog since we've got her.
Okay, great. So no weight changes then?
No, just growth. No.
That's fine. That's fine, good. So when was her last feed?
Last night's dinner around 6 o'clock.
Okay, that's perfect, Mr. Lloyd, thank you. And has she had water this morning?
I gave her some this morning around 7, but she didn't drink a lot.
Okay. That's all we really need to know about Sophie, but we'll just weigh her to figure out what measurements we'll need for later, just drug-wise and all that, and we'll just check her over quickly too to make sure she's alright.
Okay.
Just check her over and do all that. Anyway. So Sophie's looking good. That's all we really need to know about surgery, and she's 28 kg, so that's good to know. Will you be wanting any pre-anaesthetic blood testing for Sophie?
No.
Okay, well it's basically just an extra standard of care for Sophie, just to make sure there's nothing being missed before putting under anaesthesia. But if she hasn't had blood tests before, you're sure you don't want to see if there's anything that we're missing, or do you think she's happy and healthy and ready to go?
Okay, it sounds like a good plan. Maybe not today as we're a little stuck for money. And like you said, she should be very healthy.
Okay, great. That's fine. So is Sophie okay for toe clipping? Does she need her ears cleaned or to be groomed or anything?
Yes, she definitely needs her toes clipped. How much is that going to cost?
It will be an extra $20 on your fee, if that's alright with you.
Yeah, that's fine, thank you.
Awesome, that's great. So we can discuss the surgery that Sophie is to undergo in a little while, which is a bitch spay. Do you know much about them?
We have had another dog have had the same surgery, yeah.
Okay, so you're comfortable with the idea and you have no problems or questions?
No, not that I can think of. Oh, maybe just like to know how long the surgery is going to take.
Okay, great. Well, surgery will take place around 10:30, 11 a.m. We'll pre-medicate Sophie at 11 as soon as we admit her into the hospital. This is just an injection into the vein in her front leg. That's where we'll pre-medicate her. So we'll shave shave the site for injecting, and the vet may ask for a catheter to be put in, which is just the extension for the fluids. This will also make injecting the sedation drug a little easier for Sophie. After half an hour or so, 10:30, we'll take her out from her cage. She'll be a little sleepy, and we'll clip the surgical site, which is just midline along her torso, around where her ovaries are, and make it sterile by wiping her down with chlorhexidine and alcohol. Then we'll inject the anaesthetic drug. If you're worried about anaesthetic, the odds of anaesthesia affecting your dog is almost 1 in 2,000, so try not to be too concerned. She should be fine.
Yeah.
Sophie will then go to sleep, and we'll attach her to the anaesthetic machine using oxygen to have her breathe and isoflurane to keep her asleep throughout the surgery. We'll set her up in the surgery, clean the site to make it sterile, then the vet will make an incision, just a small incision, just to get the ovaries and the fallopian tubes out. And then this will be quick. Sophie won't feel a thing. It'll be over in half an hour or so, and we'll keep monitoring her. When it's all over, we'll keep Sophie warm in a nice warm bed and just wait for her to come out of anaesthesia. And then after that, we'll give her pain relief. We'll inject her with pain relief just to make Sophie more comfortable when she wakes up.
Oh, okay, that sounds good.
Yeah.
So what time will she be ready to be picked up? Around lunchtime, do you reckon?
Yeah, she'll definitely be out from surgery then, but she'll still be a bit unsteady on her feet, and we'll have to monitor for a few hours. We recommend an afternoon pickup around 3 or 4, but it depends on your availability. When will you be able to pick her up?
I think I can get her around 3.
Okay, that'll be perfect. But we'll call you to confirm after the surgery, just to make sure that 3 is okay. Also, the cost to go over is dependent on the drug Sophie will need, but generally the cost is around $180. This includes pre-medication, anaesthetic, pain relief, and because you're not having bloods, it'll probably just be $180 if that's alright.
Yeah, that's fine.
Yeah, and I'll just get you to sign this consent form. I'll just get you to read over it quickly. Everything that I've said is basically all in there, but you can just go over it, and hopefully everything's okay. Awesome, is there anything else?
There you go. No, that's fine. Thank you.
Stuffed toy.
Oh, actually, I've got Sophie's favourite stuffed toy.
Right.
That she can.
Yeah, she'll be wanting that. That's fine.
Yeah. Leave that with
we'll
you
take
guys.
that. We'll put it in a cage, and we'll name it and make sure it doesn't get lost or anything like that.
Okay, thank you.
And that should be fine. Thank you very much. We'll let you know when Sophie's all ready to go.
Cheers. I'll see you this afternoon. Bye.